As a Knight International Journalism Fellow, I traveled to South Africa in September 2011. And by October, I was in the newsroom of the South African Broadcasting Corporation Radio News. A lot of the reporting on health in South Africa focused on statements being made by the health minister or reports that were being put out by research organizations. Very seldom did they talk to the people who might be directly affected or helped or who might illustrate what the issues were. As a Knight Health Journalism Fellow, I tried to show the reporters there that behind all of those numbers, behind the government reports, were actually people, that you're not just talking about a country with the highest number of people infected with HIV. There are 5 million in South Africa who are estimated to be infected with HIV. But you're talking about people who may be aware or not aware, who have stored their stories behind those numbers, and that the stories themselves are a way of educating people about, for example, that epidemic. I guess if I were going to talk about a story that has had an impact, it is again the story of the management of the health system in the Eastern Cape, because it is such a serious problem. What I did in the case with these reporters, I had been working with them over several months. So what we did was essentially took a road trip, went into the rural areas, went into, it's right along the coast, it's considered the wild coast in South Africa, where you might see a mobile clinic once a month. And oddly enough, you don't think of it, you assume that people living off in a rural area would not be vulnerable to the conditions of the problems of urban areas. And the reporters discovered that not only did they have a serious problem with HIV, could not get access to treatment, but weren't even ashamed to talk about it, as the health department claimed. So the health department would not tell you who these people were or necessarily give you access. But if you went to these communities, these people weren't hiding, because they knew that if they hid, they couldn't get treatment. So the reporter was surprised and shocked to find people not only with HIV in these communities, people willing to talk about it. So what I hope that the reporters that I worked with will do is continue to tell stories about people. This one group of young reporters, they were so excited. Initially they said, this is not the kind of reporting we do. But then the one thing that I was impressed by was you could actually see the light go on in their eyes. Like, I talk about this all the time, but I didn't really know. And it was amazing to see just see them see, because they talk about it and they've read about it, but they hadn't actually seen it. So to be with them when they experienced or witnessed something like that, I hope they will continue to have those kinds of experiences and seek them out and probe more and look into things more and not be satisfied with just an official statement.